My paper is titled, as you can see, COVID-19 and Asian Canadians, Why Does Race Matter? And the question that I am looking at in this project is how race shapes the experience of the current and ongoing global pandemic. So in other words, what I'm interested in studying is why and how pandemics have differentiated effects on racialized groups. And within that, I'm focusing on the effects of the current COVID-19 pandemic on Asian Canadians. So in other words, how race makes certain populations more or less vulnerable during the pandemic, and how race compounds the experience of racialized populations. So we all, agree, I think, that the pandemic requires a biological cure, like testing, vaccines, viral tracing. But the pandemic, as we saw in the course of the discussions this morning, it has also exacerbated existing fault lines of racism, settler colonialism, economic exploitation, and other structural inequalities, and that is both nationally and worldwide, which points to the critical need, I think, to attend to the social structures to both understand and to respond to the pandemic. So I do, want to offer an apology that this is part of a larger project. So what you are seeing is a very, truncated version of a larger paper. And my research so far suggests that the rise in anti-Asian racism during COVID-19 must be understood in the context of the racial mythologies of foreignness and disease in Canada, which have either actively made certain bodies vulnerable to disease, such as Indigenous populations, while other bodies have been blamed for being, propagators of infectious diseases. And again, I'm focusing on Asians and specifically Chinese in this context of COVID-19. So if you look at the case of, say, indigenous communities prior to European arrival were not exposed to certain infectious diseases such as smallpox, yellow fever, and measles, which means that indigenous populations did not have the antibodies to ward off infection, and this resulted in large-scale deaths. Historians are still debating, as a result of letters that has been discovered in 1763, that the British had either used or were contemplating using blankets exposed to smallpox as germ warfare. Either way, the case that I'm trying to make, that indigenous bodies have been made vulnerable to disease as a result of settler colonialism. On the other hand, I'm looking at, what I'm doing in this project is doing discourse analysis of government documents, legislation, etc., as well as media reports from the first 6 months of the pandemic, so January to June 2020. And what I see is that public health measures in Canada has routinely conflated infectious diseases with the Chinese race and their lifestyle. So sanitation, food habits, cultural practices. And this has effectively embedded in the public consciousness that somehow Asians are, equal disease. So why Asians? And we saw that with the outbreak of COVID-19, people of Chinese descent and those perceived to be Chinese have been targeted and blamed for being originators and carriers of the COVID-19 virus. So COVID-19 has both been seen as a Chinese disease, but also racialized as Asians because no distinction is made between different kinds of Asians. Are these Asians coming as international students to Canada? Are they on a work visa? Are they fourth, fifth, sixth generation Asians? Are they born here? So those distinctions are not made. And what I want to suggest is, this is what structural racism is all about, where we see how the past persists in the present, because there are historical antecedents to what we witnessed with COVID-19. And my research project seeks to offer insights into the persistence of racism in Canadian society that becomes pronounced during moments of crisis like this, such as COVID-19. And it is at times of crisis, such as the current pandemic, that racisms that racialized minorities encounter in the everyday becomes visible and legible to mainstream society. So what I want to do is sort of, give you a brief history of Chinese settlement in Canada, because I know most of you are, way familiar with this than I am. So when we think of, Chinese Canadians, many of us think of the railroad, but it is actually the gold rush of the mid-19th century that attracted many prospectors to the west coast of North America. So although the majority of the prospectors then traveled south to California, large prospecting encampments developed in British Columbia. And then when BC joined the Canadian Confederation in 1817, the Canadian government actively recruited Chinese labor to build the Canadian Pacific Railway. So thousands of Chinese workers were hired and arrived by boat. So while cheap Chinese labor was seen as critical to the development of Western Canada, the Chinese were not seen as desirable citizens for a white Canada. So soon after the completion of the CPR, you see agitation against the Chinese gaining momentum. And the term yellow peril, which is a projection of Western fear, is first used for the Chinese and then eventually other Asians. As a menace, and they're stereotyped as dirty, as disease-ridden, and as untrustworthy. So the Chinese are first seen as an economic threat, right? The typical, story that we hear about immigrants, they're taking away our jobs. So, because laundries and restaurants are being, set up, Chinatowns are being established. So the Chinese emerge as first an economic threat. They also emerge as a social threat because their bodies and their cultural practices are seen as so different from that of the white majority. So they are seen as a threat to the white race and white civilization. But I think what is, most pertinent, these are all intersectional, these are all, connected together, but I think what is most relevant in terms of the current pandemic is that they are not just seen as an economic threat and a social threat, but the legalization of anti-Chinese racism in British Columbia and then, Canada widely was partly accomplished through concerns about sanitation and disease. So they are not just a social and an economic threat, but according to health historian Nayan Shah, they're a serious public health risk. So I want to here, offer you some sort of quick evidence of the long history of associating the Chinese in Canada as detrimental to the health of the white nation. And so this is the Royal Commission on Chinese Immigration, which was established in 1885 to determine the impact of Chinese presence in Canada. And these are some of the quotes from the Royal Commission report. So the Royal Commission report concluded that the Chinese quarters are the filthiest and most disgusting places in Victoria. Overcrowded, hotbeds of disease and vice, disseminating fever and polluting the air all around. Yet the commissioners were aware that such conditions were derived from poverty. And the overcrowded slums that we see in Victoria at that time could occur just easily among any other race that was similarly impoverished. But of course, that doesn't make it into the commission's report. Another common belief that I saw in the report is that syphilis, leprosy, and especially smallpox were communicated by the Chinese to indigenous populations, as well as other white populations in Canada. And this is despite the fact that physicians who are being interviewed to actually write this report are saying, oh, well, we have never seen a case of leprosy among the Chinese. And this is also a time when China legally required inoculation for all its citizens. So it doesn't matter what the findings are, what the interviewees are saying. Here is the Royal Commission report that becomes the ground for the Chinese Immigration Act of 1885, and you have the Chinese head tax, as it was called, brought in, right? So you have a $50 head tax that was levied on all Chinese immigrants. Again, the effort is to deter immigration, right? Stop the Chinese from coming. And the quarantine officers at the ports were all ordered to inspect all on board of Chinese origin, strip them down and examine any person suspected to be sick. So again, the disease metaphor being associated with the Chinese. And again, as we know that this head tax that started with $50 was increased over time, but that did not stop Chinese immigration. in the way that Canada wanted it to, and therefore the need for complete exclusion. So you have then the Chinese Immigration Act of 1923, known better as the Chinese Exclusion Act, which banned the entry of all Chinese immigrants. So without understanding this historical association of disease with the Chinese and North America and the long history of legalized discrimination, I don't think one can make sense of the racist attacks against Asian Canadians that became pronounced during the global pandemic. So that you have the Director General of the World Health Organization saying that the greatest enemy we face is not the virus itself, it's the stigma that turns us against each other. So for example, the first cases of COVID-19 were reported in Toronto in late January. And then, newspaper coverage shows that fake social media news, of, restaurants selling bats, images of, a Chinese woman eating bats, again, fake news proliferating, prompting residents to stay away from Chinese businesses, Chinese people, and Chinese food. And this is, what Toronto Star report, where one of the restaurant owners in Markham, is saying in despair that, their restaurant used locally produced ingredients to make their items on the menu, yet their clientele were significantly down because of its name, Wuhan Noodle. And this is a restaurant in Markham. Chinese people, irrespective of their immigration status or travel patterns, were perceived as potential disease carriers. And this resulted in the boycott of Chinese businesses and micro and macro aggressions that other presenters have talked about. And I think public policy decisions during the pandemic also facilitated the continued racial discrimination of Asian Canadians and perpetuated notions of the disease being spread predominantly, if not exclusively, by Chinese Canadians. So for instance, as we all know, the COVID-19 pandemic began in Wuhan, China, and the first case of coronavirus was found in Toronto on January 22, when a man from China arrived in Toronto. So the tide of anti-Asian racism would suggest that the virus was arriving on Canadian shores from all of these travelers that are coming to Canada from China. Yet this is, what you see on the slide is data requested by the National Post on April 17th. And this data shows that, and the travel-related COVID cases were reported for Ontario, British Columbia, Quebec, and Alberta, right? So the 4 provinces. And all 4 provinces that had the majority of COVID-19 cases. And when you look at the data, you see that it is American travelers. It's predominantly American travelers, not travelers from China who were carriers of COVID-19. So you would expect that given this evidence, that the federal government would bring in travel restrictions on American border travel, not China and other nations. But as we know, immediately, airports closed down, travel restrictions on China first, and American border restrictions were the last to be put in place. In fact, even to this day, we know that it is possible to travel from the United States to Canada without having to quarantine for 3 days in a hotel, which is required by the federal government's current public health guideline if you don't take a plane and if you just drive down across the border. So instead of amplifying this information, we have travel restrictions that suggest Chinese equal to disease. And then of course we have Donald Trump, which again others have brought up. In mid-March 2020, US President Donald Trump and some politicians began referring to COVID-19 as the Chinese virus, Kung flu, etc. Predictably, nationalist and racist rhetoric targeting China became was accompanied by an increase in hate crimes against those of Asian descent. And my analysis of media reports from January to June 2020 revealed that discriminatory actions have ranged from subtle microaggressions to outright physical aggression. And York University and UBC researchers who did a national survey in March and April 2020 found that East Asian Canadians face a disproportionate mental health impact of the COVID-19 pandemic. So to sum up then, that is what I would want to suggest is that the history of disease control is a history of settler colonialism. The pandemic has brought to light jarring failures in our public policy and the stigmatization of Asian Canadians that persist in mainstream public consciousness. Historical practices of racialization of Asian Canadians as yellow peril and the enduring racism in our public policy and public discourse has not enabled an unlearning of our biases, and it has provided, in fact, the ideological foundation for racist scapegoating of Asian Canadians at this time. So racism's tenaciousness and its seeming intractability requires us to publicly acknowledge this racist inconvenient pasts and engage in societal education about the past so that our multicultural coexistence can be grounded in justice rather than a mere tolerating of difference. Attending to race and racism is critical because when risk is associated with specific bodies, racialized bodies run the risk of being seen or read as foreign. So public policy changes through active consultations with affected communities and robust societal education through changes in curriculum and public outreach can demonstrate long-term commitments to addressing the historical and ongoing vulnerabilities and inequalities in our society. So I'll stop there. Thank you.